if that implant is not loose,
Mm-hmm.
let's say it's just the tie base.
Mm-hmm.
I mean, we could go in there and do a little plasty over those threads and try to rebuild the bone around that, but he would still get that shrinkage.
He would get the shrinkage, and then he would start to show the metal of the plastic implant. Because like you said, there's infection in there.
Right.
And with infection is inflammation, swelling. So things get bigger. So in fixing the infection and inflammation process, the inflammation goes away, means it gets smaller. So you fix one problem and you've caused another one, which is black triangles and metal show.
Now, I've seen patients that come with 20-year-old implants
Mm-hmm.
with the metal showing.
Mm-hmm.
I have tons of photos of these things, and they're fine with it
Mm-hmm.
because they don't show it when they smile.
Right.
And they're able to clean it. And we're talking about older implants. You know, implants been around for 40 years.
Yep.
They're stable. You know, they're now seeing their hygienist every 3 months. They're now taking care of it. It's almost like, you know, when you're long in the tooth
Mm-hmm.
and you have gum disease. So this peri-implantitis.
Yep.
If the patient really didn't want to undergo this massive treatment
Mm-hmm.
of removing implants, doing a bridge, vertical bone grafting, if that implant has no mobility and
Mm-hmm.
it has a 50% bone loss, if
Mm-hmm.
the patient's okay with showing the metal, would you plasty it?
Absolutely.
Yeah.
Yep. The surface of an implant as it comes is very rough, because rough surfaces are needed for it to become integrated with the bone. But the gum tissue doesn't like rough because plaque can stick to it and then the bacteria is going to spread. So by plastying it, you take the naturally rough surface of the implant and you make it smooth. Since that implant's not in bone anymore, now having a smooth surface would be better for the health and maintaining the cleanliness of it than that rough surface would.
I have some great protocols cleaning it with different types of burrs and citric acid and
Yep.
all these things, and then actually grafting it using PRF. And I've had some good success where we've gone back, you know, 2-3 millimeters of bone around an implant. But this one's pretty severe, so there would definitely be some show through on this. And then I would absolutely change the restoration if you were doing that also.
Yeah, yeah.
Because that's probably the culprit.
Probably started it.
Yeah.
Mm-hmm. Agreed.
That and the thin bone.
Yeah.
So on top of doing the plasty, you might have to augment the ridge as well.
Right.
That's a tough case.
Yeah.
Tough for the patient.
Yeah.